We come to you from a Tele Counselling Center at Chennai, run by the Chennai Corporation, and this is one such center where around 50 medicos are handling. They make calls every day to positive patients under home quarantine. They have a set of questions. The idea is to amplify the reach of the corporation to check the health condition of those on home quarantine, and also to keep track of their progress and put them on steroids if their condition in terms of the fever persists. With me, Mr. Gagandeep Singh Bedi, the Corporation Commissioner, Mr. Albi John, the Deputy Commissioner in charge of the health, and Mr. Rajagopal, another regional Deputy Commissioner. Thank you all very much for your time. What's the larger purpose of this, sir?
The purpose is that in Chennai city, there are more than 45,000 patients in home quarantine. Now, each of this person might be anxious because he or she is having COVID. We want the corporation doctors and other officials to call them up every day and inquire about, number one, their health, number two, whether they have got their medicine, whether they are eating in time, number three, whether the corporation of the staff, the conservancy staff and other staff who are supposed to take their COVID waste, are they coming on time? And most important, fourth, if anybody's health deteriorates, then he or she should immediately be able to get in touch with our staff, and we should be able to take emergent measures to bring him or her to the hospital or COVID care center or change the medicines. These are all the purposes for which our endeavor is that on everyday basis, the patients who are there in a home quarantine should get a call from the corporation.
So what's the larger picture emerging in Chennai now in terms of the daily tally?
Yeah. So the number of cases is coming down. Number of cases which is getting detected on a daily basis, it is coming down. Number of deaths are also coming down. So we feel that with the lockdown is in place and with a lot of our activities are also getting traction in the field, the cases are plateauing for now, and it is going for a dip sooner.
Is the lockdown having some kind of an impact?
Definitely, that is what we think. The lockdown with the mobility of the people has decreased, and we were also doing a lot of field activities. Our surveillance have improved, masking has improved. So all these measures together, I think we will get a dip in the number of cases very soon.
But we are not complacent about it. Our guard is there, and we are putting all efforts in this regard. Second is, we also, for example, this type of tele-counselling center, we also monitor the number of patients who are needing the immediate attention, who are there in home quarantine. And for example, the number of persons who are, like yesterday's figure we are having over here, this is one of the zonal centers. In the end of the day, how many people were feeling difficulty in breathing while in the home quarantine? In this particular zone, there are 3 persons. There used to be 15-20 persons earlier. The number is decreased. This is just one of the indicators.
Mortality is also rising. Is that a worry?
As the Deputy Commissioner Health has mentioned, mortality in fact has also seen a plateau along with the number of cases. And to address the mortality issues, not only from the medical side, also from the corporation side, we have already prepared all our burial grounds. We are trying to improve the service delivery at the burial grounds. We have given uniforms to all the people working there so that they have some identity, and also the people coming to the burial grounds have a peaceful experience at the burial grounds.
Right. And these are actually medicos doing their final year, and some of them are doctors, and it's they who actually make those calls every day. And with me, Doctor name?
Dr. Anuradha.
And tell me, doctor, what kind of questions you ask?
We usually ask them whether they have any fever, whether they have any sore throat, whether dry cough, any loss of taste and smell. These are usually the basic symptoms of COVID, mild COVID cases. So we ask these symptoms. Second, we also ask them regarding whether they are isolated inside the home and whether they have an attached bathroom. And if they suppose they do not have any attached restroom, or if they are not able to, if four to five people in a particular house has got COVID, then we basically intimate the COVID care center and we shift those patients to COVID care center, and that's what we do. And thirdly, we ask them whether they are being given yellow bags for good sanitation and all. We ask them whether they are being given yellow bags, and we also ask them whether the focus volunteers are daily visiting them and checking them whether they have the their SpO2 levels and their heart rate. And suppose if they say anything of if they are not being reported, then we immediately send the request and ask those people to come and check.
What concerns they have normally?
Normally, their concern is regarding their sore throat and their body pain. So that's what is their concern, and their concern is basically on the oxygen levels. So when the patient basically tells us the patient is having fever for more than 5 days, or their oxygen levels are going to be less than 94, we have a cutoff of 94, then we immediately tell the division health officer that who's present in that particular division, that particular area, to go immediately look at them, and they look at us and they also update us on what they have been done, the findings of the patient, and they do the things accordingly, whether they have to be taken to the screening center or to the hospital. So they call the ambulance and they do the arrangements accordingly.
Thank you so much, Doctor. And so lastly, in terms of demand for more ICUs and ventilators, of course you don't deal with that directly, but is the corporation ramping up?
See, how we are helping the health department is that right now the ICUs and ventilators are there in medical college hospitals as well as big private hospitals. But in all those ICUs, in all those colleges, there are also the patients who need to be sent to the step down level of oxygen beds. So there are two types of steps which the government is taking. Within the medical colleges and within the ambit of private hospitals also, the government is asking them. Slowly and steadily the number of ICUs and ventilators is being increased under the constant supervision of all our health secretary, director of medical education, health minister, etc. We are taking steps in this regard. As far as the oxygen beds is concerned, the Greater Corporation of Chennai has actually put up nearly 1,700 oxygen beds afresh in the last 10-15 days. And every day we are adding hospital. Yesterday we added 2 hospitals, makeshift hospitals with oxygen beds. And ultimately we plan to put more than 3,000 oxygen beds, so that the pressure on the medical college hospitals and private hospitals for oxygen at least is reduced. So that's our role in the COVID, in the fight against COVID, and we feel that we will continuously strive to add these numbers in the coming days also.
Lastly, in terms of vaccination, you told us the other day almost 50% of the 45 plus category have been reached out to. The government has launched the 18 plus yesterday. What is the plan for Chennai? What's the target you have set?
Yeah, actually yesterday our Honorable Chief Minister has launched this the vaccination drive, and today the health department they are in touch with all the districts and corporations. They are going to give the detailed guidelines. We are awaiting those guidelines. We have also made our all the zonal officers and resident welfare officers, associations as well as organizations alert about going ahead for this vaccination drive to be done smoothly. Most probably the vaccination will have to be done by registration with CoWIN, so that the persons who get vaccinated will get prior information. But once we get the detailed guidelines, corporation will try to do it smoothly in the coming days, so that the maximum number of citizens, especially between 18 to 45, and of course the left out cases of 45 plus, are also covered smoothly within the Chennai Corporation limits also.
Thank you so much for your time. The Chennai Corporation Commissioner indicating that signs of the Chennai tally coming down, at least beginning to flatten. We'll have to wait and watch whether there will be extension of lockdown to continue this trend further. In Chennai with Shah Vijay, Sam Daniel, NDTV.